Could this be the hidden cause of your chronic health issue? Let's find out. Hello and welcome. All right, so we're going to go over oxalates today. So what are oxalates and how do they affect you and what can you do about it? So number one, oxalates are found in many foods, especially the foods that we would think of as healthy. You know, nuts and seeds, kiwi, there's a lot of different teas that people drink that have them. These potatoes, grains, bran, spinach. You know, if you're eating a lot of vegetables and nuts, which you think would be healthy, you could be having an oxalate problem. Cocoa powder, spinach, black pepper. There's actually a longer list, which I'll put some links below this video so you can find out more foods that are high and low in oxalates. And, you know, when we intake these oxalates, our body really only uses about 20 to 40% of them. So that means that 60 to 80% are waste product, meaning they either stick in our system or we get rid of them. And if we don't get rid of them, they can accumulate, and that's when they start to cause problems, especially if you have certain issues, which we'll talk about in a minute. It's interesting because I had a patient that she was drinking these green smoothies made of spinach, you know, and of course we see spinach on there, and she's drinking these every day. How much oxalates are in 2 cups of spinach? 1,500 milligrams. So at the same time, no wonder she was feeling lousy. Every time she drank that, she didn't correlate the two because she thought she was doing something healthy. But again, this shows you how this, you know, things that you think you're doing that are wonderful for your body are actually breaking you down and making you worse. So what are these oxalates? What are they all about? So basically, they are a molecule called oxalic acid that binds with a mineral, and this could be different minerals. This could be like calcium oxalate, potassium oxalate. I mean, it is zinc oxalate. There's different minerals that oxalic acid will bind to. And these, of course, can be problems. So what do plants use these things for? Plants use them to defend themselves. So we know, number one, that oxalic acid can be pretty powerful. Also, it helps the plants to manage the minerals. Again, it binds onto minerals, and then it also helps with seed germination, which is kind of interesting. All right, so you know, with oxalates, how does this all work? So number one, think of kidney stones. You know, usually when in 80% of people who have kidney stones, those kidney stones, when they look at them, they're made of calcium oxalate crystals. So again, these oxalates play a big part in this. They can cause brain and nerve inflammation. They can steal minerals. So they bind onto the minerals in your body, such as calcium and zinc and magnesium, all these important minerals, copper and all these things, and they actually leach them out of your body, which can start to result in deficiencies. It's like, hey, I'm trying to get healthy, but I didn't realize these things were causing this mineral deficiency in my body, and I'm stealing these things. And then also it can deplete what's called glutathione. I have another video on glutathione, which I'll post a link to above, but glutathione is so important. It's a master antioxidant. It's one of our most powerful antioxidants in our body, and it's used for so many things, but this stuff depletes it at a really high rate. Also, it starts to corrode. It causes corrosion of the gastrointestinal tract, the lining, the mucus lining in the gut, which is extremely important. It can deposit in arteries and tissues, and this can, of course, cause inflammation. And then it can affect connective tissue. If it deposits in connective tissue, this is like joints, muscles, ligaments, tendons. So let's say you're exercising, you get injured easily, or you don't heal very well. Yeah, this could be a reason why. And then also, very importantly, it depletes certain B vitamins like biotin and especially B6. So those are very important with this. All right, so what happens is these oxalates start to build up in the body when people are having problems. Now, where are we going to see most oxalate problems? In people who have chronic health issues, autoimmune issues, chronic inflammation. If you have inflammation, things aren't functioning properly. Now, number one, if you have kidney disease, diagnosed kidney disease, or you just don't drink a lot of water and you often get urinary tract type symptoms, you're getting more susceptible. And again, oxalate can start to build up. So let's put it this way. Calcium is drawn towards areas of inflammation in our body. Let's say our kidneys are inflamed because we're not drinking enough water. We're drinking a bunch of pop and coffee and alcohol. So the kidneys get inflamed. Calcium gets attracted to inflammation in the body. And then what happens is the oxalates bind onto that, and then we start to grow stones. So this is kind of the theory of how this works. So again, not a good thing, and especially if you got kidney disease, you really want to be careful with this. Now also, if you have a vitamin B6 deficiency, which sometimes blood work can show us to a degree, but it really is not going to show us everything. So one of the most important things for oxalate issues is B6, or the active form, the important form called P5P. And then vitamin C. You know, we think we're taking vitamin C to get healthy, to help our immune system, to help so many things. Vitamin C increases oxalates. It actually makes the whole problem worse. So if you have an oxalate problem, don't be taking vitamin C. And then if you're around a lot of fungus, meaning aspergillus is a fungus that especially is noted like in peanut butter. That's where you'll hear about the most. Aspergillus is in everything. If you open a loaf of bread or open a can of peanut, you're going to get aspergillus. Sometimes it'll even accumulate in people's houses. But again, no real way to avoid this fungus completely, but certain foods are a lot higher in aspergillus, especially nuts. And these can increase oxalates. Dysbiosis. So if you have a messed up gut, if your gut bacteria are a wreck, which we'll talk more about, then yeah, you're gonna get oxalate increases in your body. And another problem that could relate to is IBS, irritable bowel syndrome. Now, irritable bowel syndrome, well, what's irritating the bowel? That's what you got to find out. But people who have IBS have gut inflammation, increased oxalate potential issues. Same thing with gastric bypass. If you've had a gastric bypass, you're not breaking down foods properly. The acid that the stomach makes in the surface area of the stomach is so important. This can increase your potential for having problem with oxalates. And then also, if you take antibiotics, when you take an antibiotic, you actually kill the good bacteria that help to deal with these oxalates, and also the antibiotic itself can increase oxalates and oxalate reactivity. So the thing is, and that's why I wrote decrease in bacteria that break down oxalates, because if you decrease these good bacteria, there's certain bacteria in everybody's gut, and these help us to break these oxalates down. So again, when you take an antibiotic, it just destroys these, and then your oxalate levels rise through the roof. So the thing to understand about oxalate reactivity, well, let's not even call it that, oxalate toxicity, this isn't an allergy. It's not a sensitivity. This is a toxicity. It's a toxic buildup of this stuff. And if your body can't dump it, then it's extremely important. Now, how do we get rid of it? Usually it exits through the kidneys, through the gut, through our bowel movement, our feces. But if we're not exiting it, again, now how would that happen? Yeah, if you've got kidney inflammation, if you've got gut inflammation, you're not exiting it properly. And if it builds up, it can actually build up in organs like the eyes, like the heart, like the liver, and then it can start to create all kinds of other problems too. Now, there's actually a condition, because this is a hard thing to really, for your doctors to diagnose, because there's really no good blood tests to test for oxalates. I mean, you can look at them on the blood, but it's not accurate with it. Do you have a problem or not? Because there's some people who have high blood oxalates, but have no problems, no health problems, no symptoms. So it's not really a correlation that can be drawn with blood oxalates. And then the way to look at the blood, though, is if you have a kidney problem. If you have kidney disease, or we notice that your bun and creatinine and your GFR is off, then hey, yeah, you might have a potential for oxalate issues. You can test the urine for oxalate. That tells you how much is exiting the body, but it doesn't really tell you if you have a problem. Now, if it's extremely high and you have kidney problems on the blood, then you could really start to think, hey, this person has an oxalate issue there. And some people actually have a genetic issue where they don't, genetically, they cannot handle, there's actually 3 different genes where they can't handle oxalates much at all, this hyperoxaluria. And there's 3 genes I wrote on there that are common, that go with this. And then there is you can, let's say you passed a kidney stone, they're going to send it to the lab and find out what kind it is. Yeah, and they can say, hey, it's oxalate stone. Then you might know you have an oxalate problem. But that's after the fact that you had the kidney stone. So that's a little frustrating. And then there is an organic acid test that can be ordered. But still, again, it's not really telling you if you're toxic. It's just saying, hey, the body's not exiting enough oxalates, or it's exiting too much. So it's a tough one to diagnose. So let's talk about some strategies with this. So, because the thing that you can do is you can try to decrease oxalates in your system and see if it makes you feel better. And this is really the true test. I mean, it's not very clinical, but it's just a way you can do it at home. You can say, hey, I'm going to eat a low oxalate diet, and then I'm going to see how I feel after maybe 2, 3, 4 weeks of doing that. Because that'll take a while for inflammation to drop, especially if you've got a chronic health condition, a lot of inflammation, an autoimmune type issue. So here's the thing you got to watch for. So if you're going to do that, you need to be kind of cautious, because you can go through what's called oxalate dumping. And this is what we don't want to occur. We don't want all of a sudden this large amount of oxalates to escape your body at a rapid rate, because this could create some damage in your gut, in your kidneys. If you suddenly try to dump all this stuff at the same time, yeah, you're going to run into some problems here. So what you want to do is slowly lower down those oxalate foods. You want to slowly lower it to where you can hopefully close to calculate how much you're getting per day, which is less than 50 milligrams is what we really want. So, all this healthy food that you thought, these veggies, these nuts, these grains that you thought were so healthy, you got to cut them out. That's why a lot of people who really want to test this, the diet they'll go to is more of a carnivore diet, because meats, eggs, dairy, very low in oxalates. These are not oxalate foods. So, I mean, everything has a little bit, but again, these are very low. And then people say, hey, I'm really noticing a difference. Or, hey, I didn't notice any difference at all. So then you don't have a problem probably. So now, as you do this also, a few other things. Number one, you want to increase your water intake because, in fact, you should always keep your water intake up, especially if you have, health conditions, because you really need to keep these oxalates coming out of the body. Also, we want to add in P5P, this activated form of B6, because it is actually the major solution for the genetic issue. So even if you have the genetic issue, the P5P is the cofactor that helps you make the proper enzyme. So that's very important. Now, thiamine is also important, which is vitamin B1. And then when you add in these minerals, extra magnesium, extra thiamine, you can actually add in extra calcium. I don't as much recommend that, but magnesium, potassium, and you want to add it in the citrate form. That's the large molecule form that doesn't really enter your bloodstream but exits mainly through the bowels, and in the potassium and the magnesium bind on to the oxalates and help pull them out. So that's just kind of a binding agent. And then another solution that some people do is they boil their veggies. They're like, I still want to have my veggies, so they boil them. And really, this can decrease the oxalates by 30 to 85%. Another thing that helps bind oxalates is chondroitin sulfate. Biotin is also helpful with this, especially because the oxalates can cause deficiencies in biotin, which can affect like your hair, your skin, your nails, things like that. And then probiotics also help. So again, we want those good bacteria in our gut to help deal with the oxalates that do come in, because they can be extremely helpful, but most people who have chronic gut issues, their gut's a mess. People who are taking a lot of antibiotics, gut's a mess. So, and there's particular ones, Lactobacillus acidophilus and Bifidobacter lactis. These are the two that tend to show the most result with oxalates. And then some people will add lemon to their water, apple cider vinegar. These things also can help. And I would say I've got some patients who actually, they will kind of have that water bottle that they sip on all day, and they'll add some the powder magnesium citrate in it or potassium citrate, and they'll just kind of sip on that all day long as they're trying to lower these oxalate levels in the body. I'll also, again, I'll put some links below to some different things and see if that should be helpful, but definitely not something you want to just go all out. You want to slowly, gradually narrow this down. Hopefully that gave you some great information. God bless, and I'll see you on the next video.